1, 2, 3.
Send us on E-Fast, please.
Dr. Garcia, can you spell world?
W-O-R-L-D.
Start with D, spell backwards.
D-L-R-O-W.
Excellent. Your brain is fine.
That's a pretty typical trauma response. You saw the coordinated effort for the whole team to lift the patient. Also, you notice that they cut off his clothes. That's done to really sort of allow for maximal inspection and examination of the patient to look for any injuries, to make sure nothing is going on that couldn't be seen because of clothing, okay? And during that whole process, everyone had a different job.
We need induction meds, ketamine and rock. Clavicle is dislocated posteriorly. I'm gonna inject an anesthetic. You're gonna feel a pinprick and a big burn. Miles, that hurt for a second. You ready? Motherfucker!
That definitely hurt. His collarbone was displaced, which means it was in the wrong spot. And what they did was they manually, which means by their hands, reduced it. They put the collarbone back in the right spot. They gave him some medication. That injection was to kind of numb the area. That's not going to take away all the pain that one would feel having their collarbone reduced. It's really important that that was reduced because it was pushing against his windpipe and affecting his breathing. So once again, this was an example of like sort of that trauma response where it's basically all hands on deck. Every physician, medical worker has a different job and they're attending to the patient.
This was a terrible idea.
Okay, Chanel, all set.
How bad does it look?
It doesn't look great. Complications from silicone butt injections.
So call the clinic that did it.
She found the guy on TikTok.
Yikes. Yikes. This patient had silicone injections placed in her butt. Not only that, but she had them done by someone she found off of TikTok. There have been a number of reports in the news about people going to other people's homes and having different substances injecting into their butt and other places. Can I just say, never, ever, 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 ever do this. It is so dangerous. The chance of infection, embolism, and so much more can happen with sort of these off-the-grid injections.
Who can tell me about the CODA study?
Well, it's from a 2020 New England Journal trial comparing surgery to antibiotics. It showed that without an appendicolith, there was a 75% success rate in the antibiotic-only group.
Exactly.
That situation that you saw there is what we call in medical school and residency the idea of being pimped. It means like when you're a medical student is when you're attending, the senior physician says, Jen Caudle, tell me what the 5 causes of blah, 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 blah. Joe, tell me the most common cause of blah, 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 blah. But you see, the one male student really knows his stuff, and he's kind of, it doesn't seem like he means to be showing up the other girl who happens to be the daughter of the head physician, but it kind of feels that way. That can be a very stressful situation to be in when you're a medical student. You want to perform well, and I remember being on rounds, being nervous to be asked about something because you don't want to be wrong, and you don't want to not have the answer, but it inevitably happens, and this is some of the social pressure that medical students and residents deal with.
Template to Dr. Santos. 5th intercostal space, anterior axillary line. Perfect. Long Kelly next. Fuck!
That is tough. Not only is the resident who performed and dropped the scalpel embarrassed, but there's a health issue, right? It's akin to a needle stick. If when you're working in a hospital, we always talk about things like universal precautions. That's washing our hands, gowning, gloving up, preventing needle sticks, preventing pokes and things like that. Clearly, this was an accident. She's going to have to be tested for infectious diseases, HIV, hepatitis, and other things. And this is where usually employee health comes in when we have hospital systems. If you get a needle stick or something like this happens, you take care of the wound, but you have to see employee health to get proper prophylactic treatment or evaluation.
Put your right leg behind his knee.
Like this? Oh.
Yeah, and you are going to use your leg as a hinge to put anterior force on his feet. Put your back into it. The hip is a big joint with lots of muscle stabilizing. Boom!
Shoot.
I don't have much to say about that scene, except for when you're a medical student or a resident and you do something for the first time and you feel this sense of accomplishment, it really feels good. And it's nice to see that she was involved and got to try something new. That was an adorable scene.
This is a healthy brain. See the black? That's blood flowing to the cerebrum. When there's no blood flow, he's brain dead. I am so very sorry.
One of the hardest things to do is to tell family members and loved ones that their person is no longer with us. It's so hard. When I was a younger attending, I cried a lot when patients died. I don't cry as much now, but I still cry. And I've come to learn actually that a lot of physicians do. It affects us deeply. Obviously, it affects the families even more. But just understand, this is days like the one this ER physician and this family are having. Of course, you never forget days like this.
You owe me a dance.
Well, I am a little rusty, but let's give it a go, shall we? Mm-hmm. Ready?
That's adorable. And so many of us have relationships with our patients where we either do a high five. I have patients that I always do fist bumps with, patients that will high five me, patients that will have like a certain phrase that they always say with me when they see me in the office, and I love it. Also, just note to self, whenever you are going to wheel somebody who is in a wheelchair, make sure you unlock the brake first. That's what Noah Wiley was doing here. As he went to go get a wheelchair, he flipped the brake on either side. You always got to do this to get a wheelchair moving.
Dylan, when did the pain start?
Started like an hour ago.
Did you get kicked or hit with a ball or anything?
No.
I need to do an ultrasound to make sure your testicle didn't twist on itself and cut off the blood supply.
Here, first of all, testicular torsion, medical emergency. As the doctor mentioned, and she's right, that's when the testicles get twisted and the blood supply gets cut off. Can happen for a number of different reasons, but if it's not addressed ASAP, the blood supply can be cut off and a testicle can be lost.
There's no blood flow here at all.
Is that dangerous? If it goes untreated for more than 6 hours, he could lose a testicle.
It's really important that I try and fix this now.
So that is oftentimes we think of as like a surgical emergency. It's an absolute emergency if you get severe testicular pain.
Okay, now.
It's fixed. For the time being, he'll need minor surgery to tack it down.
Can you please let me know how we can sign up for you to be our doctor?
I only work at this hospital and not in primary care.
Damn. Please let me know when you get your own office because you have been wonderful.
Not uncommon for when Black people see Black doctors for them to be really happy. I'm not just saying this because I'm a Black doctor. Well, maybe I am because I've experienced this as a Black doctor, but also as a Black patient. Studies actually do show that Black patients often do better when they're treated by Black doctors. This is nothing against my non-Black colleagues. There are amazing doctors everywhere. But I have found in my own practice that there are many of my patients who feel reassured to see someone who looks like them. And this can exist amongst many different cultures and also genders. You heard him say in the beginning, he actually wanted a male doctor. I have plenty of male patients who prefer a male doctor, a female. I only go to a female gynecologist because it's my preference, as an example. So there you go. But is that you? Do you have a preference for the doctor that you see? By the way, write in the comments. Curious.
Your son's driver's license indicated that he wanted to be an organ and tissue donor upon death. That means he's given his permission for that.
No, I don't want to talk about that. No.
Such a painful scene, but I'm really glad they're talking about organ donation. I'm an organ donor. It's on my driver's license. Organ donation saves tons and tons of lives. It really does. I'm not here to tell you what to do. I'm just here to say that it's something that I do, and if it's in your heart, consider becoming an organ donor too.
Hi, Becca.
Mel!
How was lunch?
It was good. We had paninis and watermelon salad.
I really like this scene because it reminds me of when I was a medical student and resident working on like surgical rotations where you're in the hospital all the time, or even like internal medicine, things like that. Even ER, you spend so much time in the hospital sometimes, well, not only to get reception, but to get some fresh air. Sometimes I would go outside to take a call real quick or go outside just to check messages. And even when I was a third year medical student, sometimes I would just go outside just to sit and get some fresh air because I really needed the sunlight. Sometimes you have to step out for a moment, and obviously you don't do this a lot. You can get in trouble if you do, and you only do this when you're allowed to. But this scene is very reminiscent. Guys, let me know what you think about the Pitt. Let me know what you think about this episode. Please subscribe to my channel. Follow me on Facebook, Instagram, LinkedIn, TikTok, WhatsApp, etc. And go to my website, drjencaudle.com. All right, bye.